Hi there. Welcome to your Bone and Joint channel. This is Dr. Shayesteh, your orthopedic surgeon. Today I'm going to talk about the lower back pain. As you might know, lower back pain is a very common disease. 4 out of 5 people experience some sort of back pain in their life. The lower back pain is the common reason for the people to stay out of work, to call in sick, and visit the doctors during the year. We wanted to know what are the symptoms for the lower back pain. First of all, the pain is the main symptom. Pain can be mild or severe. Pain can occur suddenly, or it can be chronic pain. It can be very sharp, and sometimes it's just a dull pain, chronic dull pain. Patient can experience the pain in just their lower back, or both in the lower back, in buttock area, and radiating pain in their leg. Pain can change by the positioning. It can get worse if you bend and pick up something from the floor, if you want to stand up from your chair, or if you want to sit and stand up from the bed. It can get worse. Patient might experience pop sign in a severe and acute pain. Usually they can recall some sort of pop in their lower back because of the strain, muscle strain, and the back strain. If they were doing some heavy lifting or any type of the exercise, they might experience that sort of pop sign because of the strain in the muscle. The second sign could be stiffness. That's what we said. It can be very hard for the patient to move, to change the position. So stiffness and muscle tightness can be the second symptoms that patients are experiencing. The other things you might experience is numbness, heaviness in the legs. In the lower back, especially in the buttock and in the lower back, you might experience some sort of numbness, heaviness, which it can be very irritating. So the main symptoms that we are experiencing during the lower back pain is pain, muscle spasm, and restrictions in the movement, and of course numbness and heaviness. There are many causes for the lower back pain. The first thing is strain and sprains in the muscle, mostly muscle and the lower back area. It can be because of the doing something unexpected which you are not used to do that, lifting heavy objects, bending and picking up something from the floor, or even sometimes occasions like sneezing and coughing can create a sprain and a strain in the lower back. The second cause is the fractures in the spine and the lower back area. It can be as a result of an accident, fall, or certain conditions like osteoporosis or spondylolysis. The third issue is the disc problems. As you might know, disc is an element which stays between the spinal bone. It's very rubbery and cartilaginous material. It works as a cushion between the spinal bones. But by the aging, that can change. The quality of a disc can change. It gets dehydrated. It doesn't work the way it's supposed to work. And And that's the reason we call it disc herniation, or disc moves from its place and creates the pressure on the spinal nerve, and of course can be cause of the lower back pain. The other problems are structural problems. First of all, spinal stenosis, which means spinal canal is tighter than, or smaller than, narrower than usual. That can pinch on the spinal nerve and create a pain. And of course, one of the main reasons for the sciatic pain is the pinching on the spinal nerve as a result of spinal stenosis. Structural problems like scoliosis, curvature in the spine, kyphosis, again another type of the curvature spine, which we might discuss about these type of the problems later in a different video. But any of these anatomical problems in the spinal joint, spine, and the spinal canal can initiate the lower back pain. Put pressure on the nerve, spinal nerve, and initiate the lower back pain. Some other causes might be less involved in creating back pain, but by the aging, some of these causes can increase. One of them is arthritis. Osteoarthritis is a common reason for the arthritis in the spinal area. Another arthritis is ankylosing spondylitis. It can happen in earlier age compared to the osteoarthritis. There is a different type of the disease in the spinal area. We call it spondylolisthesis. In this condition, which is the spinal bones, they slip over each other and put pressure on the spinal nerve. There are some other diseases like spinal tumor, infection, or several other types of bone cancer can create pain in the lower back. There are conditions like kidney stone or any other disease in the kidney, like infection or any other disease in the kidney, also can be the reason for the pain. And some serious conditions like abdominal aortic aneurysm also can be the reason for the pain in the lower back. We wanted to know how common is the lower back pain. As we said, 4 out of 5 people experience lower back pain in some point of their life. There are risk factors for the lower back pain. The first one is the age. Younger people experience less lower back pain. But as we get older, over 30, we start experiencing more and more back pain. The reason is the disc, which, as I mentioned earlier, it works as a cushion between the spinal bone, loses its quality and the rubbery texture, and doesn't work the way it should work, and that leads to disc herniation, disc degeneration, and finally pressure on the spinal nerve and creating the pain. Second thing is a weight. As we get more obese, or as we experience higher weight, that can create more pain, more pressure on the nerve, lower back area, more pressure on the spinal nerve, more pain, more experience of the lower back pain. So there is a subject we call overall health. Overall health considers the weight of the people, strength of their muscle, core muscle especially, which means if we live healthier, we are going to experience less lower back pain. If we get higher weight, weaker muscle, or even people they experience smoking, especially chain smokers, and excessive use of alcohol even can affect the people, and they can experience more back pain. Occupations and the lifestyle also, of course, is very important. If we have stronger muscle, if the people they have the patient they have stronger muscle, they are going to experience less lower back pain. Our core muscle and abdominal muscle are important muscles to support the spinal canal. If we have stronger muscle in the core area and abdominal area, it's going to help us to reduce the number of the lower back pain experience. But as we have weaker muscle, we are going to experience more back pain because it's not supporting the spine. It cannot support the spinal canal, cannot support the spinal bone, and there will be always pressure on the spinal nerve, and we are going to experience more and more pain. And there are some structural problems which can be spinal scoliosis, kyphosis, spinal stenosis, or any other deformities and malalignment in a spinal area can be the reason for the pain. And there are some other diseases like a cancer or any problems related to the kidney stone, infection, anything related to these areas as well can be the reason for the pain in the lower back pain. And finally, mental health. You might doesn't believe, or it might doesn't come to your mind, but sometimes depression, anxiety, stress, even fatigue, all of these things can create lower back pain. How we can diagnose the lower back pain? First of all, your doctor needs to get your history and what you experienced and how your back pain started and when was the first experience. So your doctor needs ask for your history, for your symptoms, what was the pain, what type of pain you experienced, how many times you had this pain, when was the first time, what you were doing, you were involving in any sort of exercise or work-related activities, whatever you've been doing heavy lifting or going upstairs, downstairs, running, jogging, what you were doing when you experience your back pain. The second thing is physical examination. Your doctor needs to do a thorough examination of your muscles, bones, and nerves in your lower back and lower leg area to find out if there is any involvement of the nerves and what type of the involvement is there. After the history, symptoms, and physical examination, your doctor is going to send you for an X-ray. With the X-ray, we can see bony elements of the spinal area. If there is anything in the bone, any infection, any fracture, any cancerous involvement, or anything related to the bone, we can find out. But to see the other elements, to muscles, soft tissue, ligaments, and the nerves, of course, spinal canal itself, definitely we need to go for investigation, which it gives us a clear picture of the area. So your doctor, based on his diagnosis and based on the evaluation, might need to send you for the MRI. MRI is magnetic resonance imaging test, which it can give to the doctor the clear picture of the spine, spinal canal, the muscles, nerves, tendons, and the bones. But to see the picture of the bone in a better way, we might need to do the CT scan. CT scan is not as common as the MRI. So the main diagnostic tools is, apart from the examination and the symptoms and your history which the doctor obtains, X-ray and the MRI. Sometimes in some point, for some reason, if doctor needs to evaluate the bones in a clear picture, we need to go for the CT scan. CT scan involves the X-rays in a computerized way, which it creates 3D image of the spinal bones, and we can see if there is any problem in the bones and the structures around the bone. Another type of the diagnostic tool is EMG and NCV. EMG is electromyography test, and the NCV is nerve conduction velocity. With these two tools, we will find out if there is any involvement of the nerve, any damage to the muscles, and how big it is, and what we have to do for the treatment. And final things that the doctor might ask is the blood test and the urine test, because we wanted to find out if there is anything involving your kidney or anything involving in the blood test. And sometimes for some type of the diseases like ankylosing spondylitis, we can detect the genetic markers. And with the urine test, of course, we can see if there is any kidney in the stone, kidney stone, or any other infection in the kidney. What are the available treatments for the lower back pain? First of all, in the first stage of a lower back pain, we just rest, ice, some of the over-the-counter treatment, pain relievers. You might get fine. Few days rest at home, taking just these at-home treatments, you might be fine. Within a few days, you have to go back to your normal activities, start your activity. Staying active can increase the blood flow in the area and help for the healing. So all time, they used to believe for the lower back pain, patient needs to stay on the bed for weeks, but it's not anymore like that. Within 2 days, you have to start a normal activity, get back to your normal activity. Even if you are experiencing some sort of mild pain, still try to go back to your normal walking, slight jogging, because it can increase the blood flow in the area and help for the healing of the injured disc and the nerve. There are, of course, after a few days, if you don't experience improvement, then you need to seek to visit a doctor and seek other treatments. First of all, the medications. Your doctor might recommend some anti-inflammatory, non-steroidal anti-inflammatory drugs or NSAIDs, which they are the prescription drugs to relieve the pain. Other medication like muscle relaxants, and the medications that relaxes the muscle and prevents the muscles from the spasm. Treatments like physiotherapy can come next. It can help you to relieve the muscles, strengthen your muscles, build up your core muscles and abdominal muscles, and of course prevent from the future back pain events. Sometimes some of the hands-on treatments like manipulating treatments or massage therapy can help you to release the muscles and reduce the pain as well, and help you to go back to the normal activity as soon as possible. There are injections There are injections that we consider as a treatment. Apart from the IV or IM injection, which considered as a medication, but there are injections for intraspinal injections, which usually they are corticosteroid injection. In some cases, specifically if the pain is not relieving by the medication, by oral medication or the intramuscular or intraventricular medication, it's not improving. Some doctors might consider intracanal injection, spinal column injection, which is they are corticosteroid injections. Usually we keep the surgery as a final resort for the treatment. Surgery is the final options for the treatment. Some of the patient doesn't improve with none of these things, and there is a mechanical pressure out of the herniated disc. In some occasions, in this situation, we need to definitely recommend the surgery for the patient. It can be from the open herniated disc surgery to the minimally invasive surgery, minimally invasive techniques which we do by scopic surgeries. You might ask me the question, how can I prevent the lower back pain? You can't prevent lower back pain which it comes from the spinal deformities or spinal stenosis. Specifically, the pains which it is from the scoliosis, kyphosis, or the spinal stenosis. Those problems needs a different approach and different treatment, and you might not be able to avoid any pain which it arises from them. But of course, more than 95% of the lower back pain can be prevented and can be treated easily without any surgical intervention. To reduce your risk of a back injury, you should maintain, first of all, you should maintain a healthy lifestyle. Try to have a healthy weight, avoid excess weight. Try to do regular exercise. Keep the lower back and core muscles and abdominal muscles strong enough to support your spine, and avoid smoking, excessive alcohol drinking. All these can affect, and of course reduce the stress, maintain a healthy mental status as much as possible, reduce the fatigue, stress, and depression. All can help you to avoid the lower back pain. And during the any exercise or any weightlifting which you are doing, which is related to your sport or your job, always try to do in a healthy and right position. Never bend to pick up something. Always use your leg to help you to carrying heavy lift or picking up something from the floor. And finally, you might ask me when you need to see the doctor. That would be the final question. You might to know if you are experiencing any type of the pain in the lower back, when you need to seek to take the doctor's advice. After a few days of the, if you are experiencing any type of the pain, if it is not a severe pain which you need to directly go to the ER and take the medications and get relief, but usually after a few days of a treatment at home, if your pain doesn't get better, if you don't improve after a few days at home care, if you experience any tingling, numbness, weakness, or pain in the lower back and your buttock area, if your pain is so severe and muscle spasm is so severe which interferes with your normal activities, And if you are experiencing fever, weight loss, bowel and bladder problems, or unexplained symptoms which you don't think has anything to do with your lower back pain, please seek your doctor advice and visit your doctor. That's all for today. I just tried to give you some overall view of the lower back pain and how we can approach that and when you need to see your doctor. You might feel you need to ask some questions, and I'm sure there are so many questions you need to ask. Please leave your questions and suggestions and comment below, and please make sure you subscribe to the channel. And until the next video, and until the next subject which we are going to discuss together, please stay safe, stay healthy, try to stay active as much as possible, and see you next time. Thank you for joining the channel. See you next time.